Good morning. This is the first of 3 workshops on receiving feedback on the American Rescue or Recovery money that Michigan City has received. This is, again, the first of 3. We have Zoom links for all 3 of them. Today and tomorrow, you can't physically come into the council chambers for the meeting, but we wanted to make sure that we received input from local leaders, community members, businesses, and nonprofits. As stated previously in the workshop that we held a couple of months ago, Michigan City has a $16.7 million opportunity for our community to expend funds using this money that we received. And the funds must be obligated right now by December 31st, 2024, and expended by December 31st, 2026. I know that there are some other rulings that are being worked on. But again, this is to receive input from the community. So before we get started, I do want to cover a couple of some input that we received in 3 sessions that we had previously. And there are copies up here of the raw information. If you would like a copy of it, it's here. And if you're online, you can receive it from the clerk's office as well. But we held 3 sessions previously in the community. We did one for community members, one for small business, and one for nonprofits. And I would like to thank council members Paul Privilinski, Don Privilinski, Councilwoman Tillman, Fitzpatrick, Councilman Gene Simmons for attending those sessions that we had previously. We wanted to do this in the council chamber so that we could record them and so that people will be able to find them and review them, make comments. We'll monitor those. But one thing that we will do is make sure that we give you the raw information that is compiled from that. And if you would like, I know we have some folks here in the audience, we did print out some of the information from the previous session. So I'm going to cover a couple of the things that the input we received. So from the nonprofit session, before we take information from individuals online and here locally, from the nonprofit session, we had representatives from several nonprofits, including but not limited to Citizens Concerned for the Homeless, the Salvation Army, Dunebrook, United Way, Reigns of Life, and a few others. So charge it to my head, not my heart. But these are some of the things that came out. We talked about pre-COVID challenges. And pre-COVID, some of the challenges that nonprofits face were funding operations, staffing, and training. Grants are program specific. New nonprofits are struggling to gain funding. Mental health stigma, the mirage of housing affordability when the working poor or people in poverty pay more in housing based on their income. Some of the issues that they stressed post-COVID was increased mental health issues, stress, anxiety, and depression, increased access to firearms, prescription drugs for youth and young adults, stereotyping people as lazy or bad parents because they're not working. Some of the needs that they saw, the biggest needs from these organizations were childcare, not enough, waiting lists for slots, not enough staffing, having staffing issues because it's cheaper to stay home, inconsistent childcare, veterans return to society, population, and gaps in services. They saw issues with youth and young adults, especially the LGBTQ plus, housing, violations, not just moratorium issues. Landlords were issuing issues with no recourse. Several landlords didn't want federal money because of the delay in receiving it. Rents are increasing because of supply and demand. Not enough good, affordable places to live. Other things that were presented were problems with local officials on issues. They said there are some resource access issues and how to help clients with respect and dignity, how to be culturally appropriate, and then connection to clients. They're saying there's a lot of turnover in agencies and the stigma of needing help. And then some other issues, transportation vouchers, mental health, waiting time, transportation, recruiting qualified staff, lack of access to medication leads to triggers and episodes, caregiver and social worker burnout. And then lastly, they said top priorities amongst that group was access to affordable health care, including mental health, the need for intensive case management with wraparound services and connectivity between nonprofits, child and early childhood care, salaries to retain and attract workers, and then parent and family education and affordable rent. So those were inputs from the nonprofit sector in a previous meeting that we had. Small business session, and I'll get to the community session last. We talked about businesses with less than 50 employees, and some of the concerns were government funding restrictions from the state and feds, rents that small businesses had to pay during COVID, especially during shutdown, overhead charges, rent, payroll, insurance, and utilities, even though those payments have stayed the same or gone up, the amount of money that they're bringing in has gone down. The need for retention and sign-on bonuses. They would like to see more activities downtown to bring people to their businesses. There was an emphasis on the waiting list for childcare and the possibility exploring something with AK Smith. There was a need for a cohort for insurance for local businesses, but specifically, this was brought up by a daycare organization. The need for marketing and joint events. They would like to see more transportation and bus shelters at high density areas. And lastly, more collaboration from the city, EDC, chamber, and tourism to assist with marketing and barriers for small business. And then in the community session that we had over at Macedonia, the list of items that were presented to us were free youth and family programs, youth outreach needs outside of sports like STEM, arts, and gaming, more neighborhood centers and programs, healthier communities, community initiatives, scholarships, not just for high school students, but for all citizens, drug treatment program, a reentry program for youth and young adults, I say for all, some type of mental health coordinator, grants for sports program scholarships like Pop Warner, mental health network, address the food desert on the east and west side. Also need something, within walking distance, but also a place to pick up prescriptions. A free field house. There was a discussion on crime needing shot disperse detectors. Rebuilding neighborhood watch community programs. Increased police presence in neighborhoods with bikes and segways. A Light Up Michigan City program, more code enforcement on nuisance properties, opportunities for high-paying jobs, training with internships, a renewable energy program, an entrepreneur center, and small business recruitment and retention were the items that came up. And we spent a great bit of time talking about crime and mental health in those sessions. So I'm not going to do much talking. I'm going to be taking notes more so than anything. I know that we have some folks online, and what we'll do is we'll ask if anyone would like to speak. But the goal of this session is to find out and receive input from individuals on what they would like to see done with that money. We have time to create a plan, and I know that there's some meetings coming to discuss a type of committee to gather the information and to put a plan together. Again, it's not a sprint, it's kind of a marathon. But if there are needs that are more expedient or that are a priority that need to be addressed sooner, we do have the opportunity to expend money, which we have done already. One thing that I didn't put on there, and all of these flip charts are here available, have a list of everything that was taken at all those sessions. The need for infrastructure improvements, and also broadband and Wi-Fi. So with that being said, if there's anyone who would like to speak and share some thoughts on what you would like to see done with that money, feel free to raise your hand and we'll acknowledge you and give you an opportunity to speak. I see a few people online. I didn't know. Is there anyone? Tom?
Yeah, this is Tommy Kolovic from 1316 Ohio Street. First thing, I think the school system, they got like $10 million of the ARP funds to spend. I'd like to maybe get some kind of memorandum of agreement with the Michigan City area schools. I really strongly feel they need to reestablish a driver's education program at the Michigan City area schools. In fact, make it a county-wide program for all the schools from LaPorte County or anywhere around the area come here and take driver's education. It could be offered right through the A.K. Smith Center. You know, it was always a good thing for teachers when they're, the summertime comes, they get a little stipend to teach driver's education. I don't think that would be much of a problem. I think that's really important. That gets going again. I think they cut that about 10 years ago, and the school system, they had a lot of budget cuts. It was back when Dr. Carl Iacona was the superintendent. But I think that's something that needs to be brought back. The second thing, I mentioned this before about the Michigan City transit system. It needs to be upgraded. It's kind of out of date. You go to any other city or any other town, all the buses now, they have GPS on them. It'd make it more convenient for the riders. All you got to do is simply pull up your transit app, and they got bus trackers on. They show you exactly where the bus is at in the city, and it tells you right exactly to the minute when the bus is going to arrive at your stop. And they need a more modern form of payment system. A lot of places you go now, they're going cashless. A lot of people, they don't like that, but hey, that's the way it is. You go to the bus, a lot of it's just tap and go. You set up your account on your thing. You shouldn't have where you just put the dollar in your cash box and go. And what's really archaic is if you want to get a monthly bus pass, you got to go up to the controller's office at City Hall, and you plunk down your $20 and they give you a paper pass. That's like really archaic and needs to go. So, you just go online, you buy your $20 bus pass, and it's all digital now. I've always talked about this too. I think I'd like for Michigan, we need to have an outdoor community public swimming pool. Back in 2009, they tore out the park department. They spent $1 million, and they tore out the tennis courts and they put up that splash pad. That splash pad now is not even in operation anymore. We haven't ran it in the last 2 years. So what did it do? We only had it for about 10 years, so it had an amortization rate of $100,000 a year. That's, would you like if you've been making an investment into a company, that's not the way to go. So I guess that's we try to keep people out of the lake on bad days. That'd be a good way. It'd be a great tourist attraction. It'd be great for the local residents. Those are just my thoughts for now. Thank you.
Thank you, Tom. Let me add, so the Michigan City Area Schools has approximately, and I know I'm not going to have this right, probably close to $25 million for their ARP tranche, or at least half of that. I did meet with School Superintendent Barbara Easton Watkins and Assistant Superintendent Dr. Wendell McCollum early in October to talk about their plan. They actually are working with a consultant to help them develop their plan. They were awarded an opportunity to work with a consultant to help go through that process with them. I know a lot of their emphasis has been on not just the gap, literacy gap, and especially during COVID with students being at home and making sure there are additional opportunities for bringing up their scores and all of that. But their full plan, I don't know if they presented it to anybody yet, but I know that they were in the middle of heavy into developing that plan early in October. So I guess I'll have to follow up with an update, but I did meet with them in person to discuss their ARP money. All right, who else would like to speak? I see Pastor Williams. Did you want? Okay, there you go.
I'm just kind of listening to everything. I definitely know that the mental health is a key component. So a lot of things you've already said, I totally agree with. Piggyback on the school system, I definitely believe that we need to do something about the special education department in the school systems. I just don't think it's enough being done for that component. So a lot of things as I pastor, and as your pastor would probably agree, low income is a major issue. Jobs, finding places to stay. With the rent going up, but not having adequate jobs to equal or level that out. Just something needs to be done in that area.
Thank you. Are you finding that people are having issues with any type of rental or utility assistance?
It varies, Miss Angie. It does vary. On one end, obviously, if they can't afford the rent, they can't afford the utilities. And some people are actually picking between utilities or medicine, for mental illness, or utilities and food. So I think it's a problem across the board for that.
Thank you. I can't see everybody on there. Katie Eaton, Executive Director of the Chamber.
Good morning, thank you. I just would like to mention, we started a small business council this year, which you serve on, and a number of other businesses serve on. Here at the Chamber, small business has always been a focus of ours. Over 60% of our membership is made up of small business in the community with really 10 or fewer employees. Some of them long time established, some of them very brand new. So that longevity and then newer creates a variety of opportunities for us to support those businesses. We had an opportunity earlier this year to work with a couple other organizations across the region on a small business administrative grant that we submitted a piece for, specifically to create a position within the chamber that would focus on small business. And it was a really kind of a boots on the ground position that we foresee, someone who can become the connector in Michigan City for not only newer small businesses, but even those that have been around for a while. I think one of the things that the pandemic taught us about small businesses is that digital marketing, as well as bookkeeping, even logistics around staffing and how to navigate some of those uncharted territories over the last 18 months, 2 years is a piece that we were able to assist with, but could have done a lot more if we would have had an additional person on staff to help with that. So we do have together already a proposal for something like that. Definitely would love to work with our partners on what that could look like a little more closely. I obviously with Small Business Development Center, the Entrepreneur or the Economic Development Corporation here in Michigan City, I know that they're working on some entrepreneur pieces as well. We'd like to see, how we can work together and create a position or additional funding for a position that would be able to really assist those businesses on a local level in connecting them with the partners that are out there and the resources that are out there. So happy to continue those conversations with you and with our partners that are working on that right now.
All right, thank you. Anything else that you're hearing from the local small business that I didn't mention from the session that we had previously?
No, I mean, staffing tends to be the biggest topic that we're having with most of our businesses, small and large. There just are not enough people that are willing to go back into the workforce, and I think there's a variety of reasons for that. I think you hit on some of them. Mental health, people are really taking a closer look at that and what does that mean for themselves and their families. And when you add on additional pressures of strange shifts and family balance and not enough childcare and all of the other things that really have piled up over the last 18 months. Mental health tends to be one of those things that they're just not wanting to give on, and they want to make sure that they're creating a better place for themselves and for their families. And then there's always a skills gap when it comes to certain positions, not only in this community, but across the country. So all of us working together better to make sure that we're identifying what those skills are needed in the community, and then working with our private businesses and our educational partners to make sure that we're identifying those and working on a path to get workforce into those pathways to get them employed for the jobs that are available here in the community.
Thank you, Katie.
Yeah, childcare is definitely a piece that if there's a way for us to work on that in the community and make sure that there is enough spots for all of those that need childcare and that it's affordable and high quality, working towards that as a community, I think would be a huge benefit, not only to our families and our residents, but to our business community as well. Without their employees having a place to safely take their children on a daily basis, it makes it more difficult for them to show up for work and be productive. So it is not only a community issue, but it is a business issue as well.
Awesome. Thank you. And I'll include you. Mary Hervey, Dudley Hervey, and I are working to bring something together. So
I just spoke with her recently. So
we'll make sure you're in the loop on that.
Awesome. Thank you.
All right. Who else? Anyone else from the community? I see that we have Liliana Clarence on. I can't see the other name. Oh, she's taking notes. All right. Clarence, did you have anything?
Not necessarily. Just kind of want to re-echo some of the things you said regarding some of the community needs. We have, small business assistance is big, whether it's through direct funding, programs for training. Talent attraction, maintaining talent is big for Michigan City. How do we get people into jobs that pay, fair market wages that they can support their families, but also the wraparound services people need when they get a job. That's something that we're looking at especially with Goodwill, because we know a lot of times people can get a job but can't maintain a job due to whether it's, as Katie mentioned, childcare, transportation, or mental health, or any other issues. So looking at how do we provide, or how do we find partners to provide those services that people can maintain a job after they get a job. Right now, our employers, large, small, white collar, manufacturing, there's just a big need right now for people. We have one of the higher unemployment rates, but also employers are telling us that they can't find people. And that's like kind of a catch-22 because employers also need to start changing the way they hire while also attract people. So we're looking at ways to try and work with employers to make sure they can look at people who are in front of them, especially those who are here in Michigan City, but also work with our residents through Work One, Goodwill, and other agencies who can help provide services to ensure they can get a job that pays a fair market wage.
Would anybody like to speak here in the audience? You have any questions or have any suggestions or anything? All right, just making sure. Anyone else online? I can't see.
Hi, this is Dahlia Gigas. Hi, hello.
Hello, Councilwoman.
Hi. I would like to just kind of chime in that childcare would be helpful both for families and for businesses. I think that's got to be a priority. Of course, we have to think of this as being sustainable, so setting something up that could continue to go. And I'm just interested in how we're going to prioritize. All these things seem important to me, and I just think we have to really think critically and figure out what's the most important.
So around childcare, a couple of things that came up in a couple of the sessions was the fact that there aren't enough slots for childcare currently. With COVID, several daycares had to lower the number of slots that they had, but also a backlog on vouchers, the need for increased staffing was another issue that they brought up. But in every single session, business, nonprofit, and the community meeting, they all brought up childcare and early childhood care. So that's something that you may have to tackle with the school system as well. So that's why I had the initial meeting with the school superintendent and assistant superintendent to see how they were addressing it. But I think it's more to, we talked about Purdue Northwest and Ivy Tech and AK Smith and how maybe they can assist in filling the gap for workers. So those were some of the conversations that we had about childcare. But again, in every single session, childcare and early childhood development was something that we spent time on. So I think it's a priority because it showed up. The two things that showed up everywhere were mental health and childcare. So if that's any indication on priority. Council President Michael Mack, is he still on? Nope, he's not on. I see ML Wall. Did you have anything you wanted to add, or Ms. Franco? All right. Well, again, if you would like information, any of the additional information, we have copies in the clerk's office of all of the notes. We also have all of the sheets that we took at those sessions available if you would like to see them. Tomorrow we'll have those same sheets here as well. It's about 20 sheets or so of input from the community that we received, but also we have kind of the raw comments from everybody on these sheets as well. It can be emailed to you, or you can pick a copy up in the clerk's office. And then tomorrow, the session tomorrow begins at, we tried to set up multiples because I know that people can't make sessions every day or in the evening. Everybody doesn't have the ability to be in person or to get away during the day or at night. So we tried to be flexible on the time of days that we were having these. So tomorrow's session here in the council chambers is at 12 p.m. And we will post the link for the Zoom session at that time. If you have any input or questions, feel free on the Facebook page to post them there. That way, the city administration, the mayor's here, and the council people can see your comments. So feel free to please post any comments or any concerns you have about the ARP money so that we can see those and get those listed and provide that feedback to the city administration and the city council. So with that being said, we're gonna end the session unless someone else has something to add. And we'll see you tomorrow with any more input that you might have from the community. Thank you.